I don't mind the ads, I don't mind the buffer, but when the ads buffer, I suffer. That's good. You may be a poet and not even know it. Haven't done a responding to comments video in quite a long time, so I'm excited to see what questions you have for me. I'm gonna be tackling health questions and fun questions. Q Leaf, your shirt is tight, that you look like an intelligent stripper. Actually, Rachel Ray said that to me once. She said I look like a Chippendales dancer. Yeah, like my shirt's fitted. You can show off your physique, everything I work for in the gym, in the kitchen. By the way, I'm vegan right now. It sucks. I mean, I didn't say anything yet. You'll see the results in my 30-day vegan video coming soon. Matt Kenny, what's the deal with your presentation in South by Southwest? How come we didn't see it? It was actually an awesome presentation. I partnered with Vox Media and 3M talking about the power of silence. I did a whole video dedicated to this subject. The idea of silence needs to be incorporated in our lives, and 3M is making some amazing strides in making this happen. Like they even talked about on stage how they make our commute quieter so that we can have time to ourselves in the car when we're not being attacked by employees and job duties and social media. I think the brain needs silence every now and then. Taylor, how tight do you want your shirt? Mike, yes. Okay, I do take my stuff to the tailor. Some stuff. Actually, this is fresh out the bag. Out the bag. Why Ella? I feel like it's a Beyonce song. Or no, Rihanna. Whoops. I have a question. I've been getting my period for 3 weeks straight. Is that all right? Ella, that is not all right. There's something abnormal going on. Good reason to talk to your doctor about your cycle. Questions that you should be prepared to answer. How long has this been going on? How long do your cycles last regularly? Are they regular? Are they irregular? Are you sexually active? Is it possible that you may be pregnant? If you come ready with all of these questions in mind, it'll make for an easier doctor's visit for you. James, STFU. I know what that stands for, James. Yo, Mike, I know you're a Russian spy, bro. I'm watching you. No, I'm not, bro, because if you would have known, I would have already ended you. Trust me, not a spy. Like it here, much better. Yeah, Mike works hard, but his shirt works harder. What's with the shirt stuff, man? Stop getting on me. Why do you think I wear a tie? It's because the buttons are about to say peace. Bag of Cheetos, S. He attack, he's a snack, but most importantly, he got nurses back. Damn right, I got my nurses back. I defend them. Shout out to all the nurses I work with. And CMAs, because y'all don't get enough love. I don't know why I'm doing this accent. Maybe because I did that. Pros Kirby, can you do a video on premature graying? I need to do that, sadly. I don't know if you can tell. I'm premature graying. I'm in my 20s and I have gray hair. Sad. Sonia, collab with Glamgore, please. This is happening. We've exchanged Twitter messages. I love her content. It's super fun to watch. I really want to collab, but I do know she's taking a personal, mental, physical health break from YouTube, which is totally awesome. I support creators in doing this. They know themselves. They know their limits. Hey, Dr. Mike, what's the correct way to stop a bloody nose? Tilting my head back and swallowing the blood makes me nauseous. Thanks. That is true, Annika. You do not want to tilt your head back because swallowing that blood will not only make you nauseous, but it can wreak havoc. It can wreak havoc on your digestive system, causing diarrhea or constipation. So what I recommend for my patients to do is to tilt their head forward, pinch at the base of the nose. If you get something cold there too, that will help. Because ideally what you want to do is pinch the blood vessels off so that less blood gets to the area, and therefore you'll be better. Another little life hack, you can get a nasal spray, like one of those constricting nasal sprays for congestion. Spray one of those bad boys in, it'll shrink the blood vessels, and therefore, you're gonna have less blood flow and you'll lose less blood. Peter Ola. Hi Mike, I'm just wondering what car/cars do you own? Peter, great question because I absolutely love cars. I'm actually driving my childhood dream car at the moment, an Audi R8 Spider. It's actually funny to say that because I used to have an Audi TTS back in the day. I crashed that car because of a Spider. I have to tell that story on my channel at some point. If you're interested, hit it below in the comments. Unicorn Love. Hey doc, I feel hard and wet down there even when doing simple, common things. May I know why? Love your videos. Some of us get attracted to things, and that's okay. What? Myself ×2. What are your thoughts on women choosing female doctors? Do you think it is silly to be shy about seeing male doctors? I don't want to say it's silly because everyone's entitled to have their own thoughts and anxieties and so forth. But I have spoken to women, and recently, as you'll see soon in our collab video, I spoke to Molly Burke.
Oh God, pap smears. I don't even want to think about it. I will actually say I prefer when men do it. I find because they don't know the feeling. They'll never know it. They can't experience it.
So you think they're extra
more
careful?
sensitive.
In my practice, we try and instill the fact to our patients that each of our doctors is well trained and capable of seeing any sex, but if they have a very strong preference, we'll try and accommodate to the best of our ability. Cruise. Eat a can of Pringles and go to the sauna. Yeah. I don't quite get it. I love saunas though. I'm actually gonna make a Wednesday checkup dedicated to saunas. If you're game. You game? Hit me in the comments. Sauna. Me. Pringles. No Pringles, just me. Sauna. Yeah. Anna Hearn. If you had to move to another country, where would you move to? Love your videos, by the way. Thank you. Ooh, where would I move? I would like to move somewhere where they speak English as a first language, because that will help. I like Australia. I like their climate. It's warm. There's lots of sunshine. Pretty isolated, so bad people can't get. I don't know where I'm going with this. Australia. That's my answer. Golden T. Genter. Is it okay to sleep with a fan pointed at you? I heard it can cause a stroke of some sorts. This is really good. I don't recommend having any kind of cold air blowing on you for an extended period of time, including air conditioner or fan, or a window open even while you're driving a car. The reason being is if you overcool a muscle in your neck, let's say if the fan's blowing on your neck all night, and you constantly have this cooling sensation on your neck and you're already sweating because it's hot, you're gonna overcool that muscle. You're gonna get less blood flow to that muscle, so it's gonna constrict and get really angry. So when you wake up and you use it and it spasms on you, you're gonna have a very stiff neck. So one of the first questions I ask my patients that come in with a stiff neck is, did you just drive for a very long period of time with the windows open, have the AC blow on you, or a fan? Happens quite often. Beast Girl, do weighted blankets really help with anxiety? Please like so he can see I really wanna know. Do they treat anxiety? No. I mean, let's be realistic. If it was that simple, I would just be prescribing anxiety or weighted blankets to all my patients. I think what I like about weighted blankets is there's some kind of innate human feeling of having something a little heavier on you, that the blanket's not gonna just fly off, and it's warm. Personally, I like heavier blankets, even in the summer when it's hot, but I think making claims that they help with medical or mental health conditions, it's going too far. Aaron Nixon. I think Dr. Mike is not named Mike. I'm not. My true name is actually Mikhail Varshavsky. I wonder if people knew that. Luis Herrera. Hi, Dr. Mike. Can you explain the whole man flu phenomenon? Do men experience signs and symptoms worse compared to women? I have heard this somewhere, and there was a study talking about how men complain more about their symptoms, or when they have the same exact symptoms, say that it affects them more. Why this happens, I'm not sure. I want to say men are babies, but I feel like I'm being unfair to men. I would say I have witnessed this. And I also will say that men don't like going to see the doctor. So that if they're coming to see me, something really must be wrong, or a woman in their lives have encouraged them to go see a doctor. Frank Mazzarzi. Dr. Mike, what's your blood type? I'm A-. I don't know what my blood type is, but I think if it should be anything, it should be A positive because I'm an A positive student. B positive because I want to be positive. Okay, moving on. Diana Capano. Hi, Dr. Mike. I'm a recent nursing school grad, and we touched upon the ethical issues of slow codes. What is your personal perspective on the issue, and did they talk about this in med school? Diana, great question. For those of you who don't know, slow codes is when someone's heart stops and they call a code blue and they essentially are dead and you have to revive them. Slow codes is when you believe that a patient shouldn't be revived and the patient or the patient's family is making a bad decision where you don't necessarily do everything you can to revive them because you don't think it's in their best interest. I'm not a fan of this personally because I think everyone has a choice in their healthcare, and if they choose to make that choice on their own or they choose to have the families make that decision, I think that's in their, that's their right, that's their prerogative. Just my 2 cents. Question, why do I keep getting cold sores? Do I know what I can do to make them stop, or why even get them? Well, generally speaking, if you're getting cold sores, you have herpes. It's herpes simplex. It's a virus that stays dormant inside your body unless it breaks out in a form of a cold sore. Now, if you've gotten one cold sore, that means the virus is with you for life and will occasionally pop out when you're stressed, when you have a weakened immune system, like if you have a virus, a bacterial infection, and so forth. My recommendation to you would be talking to your doctor about how you can stay as healthy as possible, which is focusing on all your lifestyle habits. And then if you're still getting outbreaks very often, you can talk about a medication, which is an antiviral medication, which prevents these outbreaks. And you could take it daily, not just when you have an outbreak, in order to reduce the number of outbreaks that you do get. Dom the Alien. Have you seen an increase in patients or people trying to become your new patients since you started your channel? I have seen that. It doesn't happen as often as you'd think. More often what happens is a patient is in a room, I walk in and they're so surprised to see me because they watch the YouTube channel, but them reaching out on their own doesn't happen often. And in general, I tend to not accept new patients because my patient panel is so full. But there's plenty of great doctors in my practice that are accepting new patients. Do you tell patients to subscribe to your channel? Imagine I walk into a room, hi, I'm Dr. Varshavsky. You were just involved in a code blue. Please subscribe, please sub. In reality, the only times my channel comes up with my patients is if they already know me, or in the instance that we've run out of time and a patient wants to know about a specific subject and I know I have a video on that subject, I'll then recommend that they check out one of my videos. But I don't push it on anybody. That's not for office time. That's strictly for us. Me and you and me, you know, YouTube. Karen Cobster, dumb question. There is no such thing as a dumb question. In a heated situation where one has to perform CPR, how does a person ensure that no ribs get broken, particularly the ones nearest to the lungs? Well, almost all the ribs are near the lungs. It's not something you should think about. That's the bottom line. What you should think about is making sure that help is called, that you've nominated someone to call help or called help yourself. And right away, if the person's not breathing, no pulse, to start pounding on that chest, doing it at 100 beats per minute, singing Staying Alive, if you will, and pushing at least 2 inches deep. So you gotta push pretty firmly in order to make that happen. If you crack a rib, no worries. You're extending the person's life in order to get them help. They're already gone. By doing the chest compressions, you're actually increasing their chance for recovery. That's the best thing you can do when someone's heart stops. Who tends to bear when you work a long shift? Robin Cherry Siegler. The great thing is that one of my close friends is my neighbor, so he gets to hang out with Bear. Then my nephews oftentimes take turns coming to see Bear. Sometimes I have someone clean my apartment while I'm not home. So there's always someone taking care of Bear or hanging out with Bear when he's alone for a long period of time. And I don't work the 14-hour shift that you guys saw on my vlog the other day all the time. That's like a once a week thing where I have a really long shift that I wanted to take you with me on. But in reality, most of my shifts are shorter than that, and Bear's not alone for more than, 6-8 hours, which he's totally fine doing. And he sleeps in the bathroom even if I'm home at that time anyway. Bear! Do you hear his little feets? Hey! Hey! Hey, little puppers! You want to say hi to the camera? They want you to say hi. God, you're such an aggressive kisser. Bear, ask for consent. Connor Perry, can hats give you headaches? Great question. There's actually a type of headache that's lesser known. It's called a compression headache from wearing helmets, headbands, hats. All of those things that can put unnecessary pressure on your scalp can actually cause you a headache. Not to worry though, generally when you take those things off in a few hours, maybe if you need to take something over-the-counter medication, it'll go away. But the reason this happens is because there's always movement between the sutures of your scalp, and there's always a little bit of movement. There's blood flow that needs to happen. There's a little bit of expansion there, and when you don't let that happen, you could actually get a headache known as a compression headache. So Connor, great question. Is it true that stress can lead to the growing of white hairs? First of all, Ariel, I gotta tell you, I got them white hairs. What's happening is actually you have a decrease in melanin producing cells called melanocytes in the hair follicle. If your hair is white, that means you completely have lost all your melanin. But if you have some, you get gray hair. So it's almost like partial pigmentation, if you will. Now, the question you asked is if stress affects it. We know genetics is the most important thing, but stress seems to play a role in this. I've looked into this myself. We don't have a cause and effect relationship. Let me tell you that outright. But when we look into it, we do see some sort of pattern and correlation emerge between those who don't sleep enough, who have very competitive jobs, high stress levels at work, family members. They generally gray earlier. Our reasoning for this, which is unproven, but what we think happens, is that there's an inflammatory response from free radicals that occurs from stress. And that actually interferes with the melanin process, like the way that the color is brought to the follicle. And when that happens, you're more likely to gray earlier. While science hasn't given us a definitive answer, I'm gonna give it a preliminary true, that stress does cause your hair to turn gray sooner. Is cracking my knuckles a bad idea? Will I get arthritis? Well, Henry, I can't promise if you're gonna get arthritis or not. But what I can tell you is that medical research has looked into the science of cracking knuckles. And that sound that you hear is actually just nitrogen bubbles popping in your synovial fluid. Synovial fluid is the stuff that lubricates your joints. And when you hear that cracking, you think that's a bad thing, that's your bones breaking or anything like that. That's not really the case. It's these completely harmless nitrogen bubbles. And there's been really decent evidence that shows it does not lead to arthritis. And unless it's causing you some kind of pain or discomfort, it's usually and generally pretty harmless. If it makes you feel better, psychologically speaking, crack away. And as long as you're not bothering anybody, that's fine. Now, if you're getting pain when you're cracking, maybe you already have arthritis, maybe you have a tendon injury, definitely don't crack in those scenarios. If you find yourself needing to crack, otherwise you do have pain, that could also be a sign that something's going on and you should talk to your doctor. But in general, know that when you crack your knuckles once, see, like, now I can't crack them again. The reason why is because you need to give time for those nitrogen bubbles to reform in the synovial fluid. It's kind of a fun fact for you. Catherine Allard, how many patients do you have? Just wondering. Oh, that's a good question. I see around 30, 40 patients a week in my outpatient office as a family medicine doctor, doing primary care stuff and urgent care. And then I have probably a panel of, like 500, 600 patients that I've built up from residency who I'm their primary care doctor, that when they schedule an appointment for a follow-up, whatever it is, they schedule it with me. This panel of patients that I built up, I have a very close relationship with them. Not all of them come in all the time, and sometimes they can get care from one of my colleagues, but they're important to me because we've established a rapport, I know their history. That's the beauty of having a family medicine doctor, so that we don't give you unnecessary care, and we can guide you to the best specialist, the best imaging places, the best physical therapists, all of that. Navigating the health system can be a really troublesome feat. And if you have a good guide and a family medicine doctor, it's gonna save you a lot of time, money, trouble, and you're gonna get better outcomes. Marcos Morales, aren't canker sores and cold sores the same thing? They may look similar, but they're actually not the same thing at all because of their cause. Cold sores are caused by a virus, and canker sores are sometimes can be caused by a virus, but usually they're caused by some sort of stress. Whether that means it's a stress to your immune system, it could be a stress, like a physical stress, like if you have braces and they're rubbing along a specific part of your mouth, the inside of your cheek, you can get a canker sore. Also, hot liquids, spicy foods can sometimes cause canker sores. It's really a physical stress. Cold sores come from a virus, and unless you have been infected by that virus, you're never gonna get a cold sore. Canker sores, you can get virus or no virus. Kelly Vo, hey doc, what's your intake on dragon's breath, AKA liquid nitrogen? Is it safe to consume? What? Dragon's breath? It doesn't sound safe, so I wouldn't do it. The only thing that should be going into your lungs is air, and ideally you like it to be clearer air, like what we're breathing in New York City is not ideal. So, no, I think liquid nitrogen doesn't sound safe to consume. I need more information before I give you an official doctor's recommendation. Lydia Dimmock, I often lucid dream and walk and talk in my sleep. I feel like some nights it could be causing me to be deprived of sleep. What should I do? Ooh, that's a good one. Sleepwalking is actually a problem. And sometimes people realize it, luckily, because one of their partners realizes it, their family members realizes it. The real solution here is to get a proper workup from a doctor, hopefully one that specializes in sleepwalking, so that we can figure out the cause, perhaps give you a treatment for the cause, whether that means lifestyle changes or even medications, and monitor your sleep to see if it continues happening. But know that there are treatments out there. Shruti Kulkarani, what can we do to reduce muscle soreness after exercises? Oh man, this is something I struggle with. DOMS, delayed onset muscle soreness. Man, I get this so bad on the second day after like heavy workout or a new workout. Things that I do that I think work quite well. A, warm up and cool down are crucial. And it doesn't mean stretching, it means like dynamic warm-ups. Those are ideal. The second thing is I love massage. Even though massage may not improve circulation as much as we'd like in muscles, it still feels good. It's relaxing, it lowers your cortisol levels, which allows you to recover better. And then the final thing is, on the day after a workout and you feel sore, and even the second day after, do a little active recovery. Do some of the motions that are sore, but don't do them with heavy weights. So lower by like 80% the intensity of the action, and you'll see that your blood flow will start to improve and you'll get better recovery. That's something I really enjoy doing. Entity 303 does stuff. What is the best way to remove sodas and energy drinks from your diet? The best way. Cold turkey. Walk to your fridge, take them out, spill them out, recycle the bottles, and then say you quit. If it's not in your home and you don't buy it, you're not gonna drink it. That's the bottom line. Maddie Baker. I wanted to go and follow you on Twitter, but your account is suspended. What did you do? I didn't do anything. I think my Twitter account is fine. I'm gonna look it up right now. No, my Twitter account is fine. Maybe you wrote this a long time ago. First of all, you need to follow me on Twitter. It's real doctor spelled out Mike. I post some good articles. I give my opinions on things. You really should be following me there. So go on Twitter and follow me. Roar the dinosaur. Is it a good idea to remove bullets lodged in your arm? I'm gonna go ahead and assume that what you're talking about is an old bullet, like something that's been lodged inside your body for a long period of time. Not all bullets have to be removed. Some, if they're not causing a problem, you can do more harm than good by removing them and going in operatively. Some need to be removed right away, and some can be problematic because they could be a source of infection. So it really depends on when it happened, how it happened, the area where they are, what your anatomy is like. But what I could say very confidently is you shouldn't remove bullets lodged in your arm. Let a doctor do it. Let them decide if it's warranted or even safe to do so. Jillian Arthur, do patients get ticklish? Oh yeah, they do. I mean, my pediatric kids especially. Like when I'm pressing on their belly, if I want to check for appendicitis or whatever, I'm checking in their belly and I'm pressing and they're laughing and they're not in any pain, I already know that it's very unlikely to be an acute abdomen. So I like when my patients laugh and are ticklish because then I know nothing serious is going on. Can taking large doses of Benadryl 15 daily for sleep cause long-lasting damage? Yes. Do not take 15 Benadryl at night for sleep. Seriously, that's asking for trouble. Benadryl is not a benign medication. It truly has side effects. If you're needing 15 Benadryls to sleep, that's a sign that something's not right going on inside your body and you should be evaluated properly by a doctor. Yes, the potato is looking at you. First of all, dope username. How can one decrease their libido asking for a friend? Decrease their libido? Every question I've ever been posed by a patient has always been to increase their libido. If you're asking to decrease your libido, perhaps there's something going on medically that should be evaluated. There's rare conditions that can cause you to have an overly increased libido. If you're really asking for a friend, tell them to go see their doctor. Ali Cato, why do my ears hurt after I wear my headphones for a couple of hours? If you're talking about earbuds, I have the same problem. Like I have the Apple AirPods and after a while, the plastic starts putting pressure on my tragus here and it really hurts after a while. The over-ear headphones generally should be pretty comfortable and not causing you pain, especially superficially on the outside of your ear. If your inner ears hurt, that's a sign you're listening to your music too loudly. Generally, what I recommend is no louder than 60% of the volume that you should be listening on your phone. Alan Balse, do hats/caps cause baldness? In very specific circumstances, meaning that if you're wearing a really tight baseball cap or some kind of scully where you're actually putting traction on your hair, that can cause a type of baldness called traction alopecia. I think that's exactly what it's called, where you're actually pulling out your hairs from that constant pressure. But otherwise, if you wear a hat that's well fitted and not overly tight, it's not gonna make you lose your hair. In fact, most men will incorrectly assume that this can happen because they like wearing hats, they experience male pattern baldness, which is a hormonal issue, has nothing to do with the hats, and then they'll go ahead and blame the hats. That's an area of correlation versus causation. Like men wearing hats at a certain age, experiencing baldness at that same age, they think, oh, look, these two things happen together, they must cause one another. They don't. Sarah Darwich. Question for Dr. Mike. How and when do you recommend eating around night shifts? I find it hard to plan. I do not have great advice on this from a personal standpoint because every time I was on night shift, it was absolute mayhem in the hospital. The thing that I tried to do was anytime I had a moment of silence, I would go and eat something small, so that I always had some kind of food at the ready, whether it was a small salad, a protein bar, some kind of fruits to go. Something small will keep you feeling full, energized, as opposed to just eating one giant meal in the middle of the night, getting overly full, sleepy. That's gonna make your life complicated. And the one thing I would avoid at all costs, if possible, of course, is caffeine at night, especially if you're alternating between day and night shifts. That'll throw off your circadian rhythm really badly. Fluffy toast. I would love for some fluffy toast right now because I'm whole 30, no toast for me. I have really sweaty hands. What causes it to really sweat, and is it normal? If you have really sweaty hands, that could be a condition called palmar hyperhidrosis. Palmar meaning the palm of your hand, hyper meaning more of, hidrosis, sweating. This isn't that of an unusual condition, but it causes a lot of distress to people because when you're shaking people's hands, interacting, it's obviously very uncomfortable. Treatments for this usually are antiperspirant, like the thing we use under our arms, but here to plug those sweat glands. The glands that are found here are mostly eccrine sweat glands, which start sweating not to thermoregulate your body to cool you off, but really as a result of nervousness. You have the sympathetic nervous system, which is your fight or flight response nervous system. That's what happens when you see a lion, when you're about to give up speech, when you're arguing with your partner. That's why your hands sweat. As a result, those sweat glands start releasing that fluid. Now, when you put antiperspirant on, you essentially block those ducts, no fluid gets released, you sweat less. Sometimes they don't work. You can use clinical strength products. If that fails, there's always Botox injections. Yeah, you can actually inject Botox into the sweat glands of your palm to reduce that sweating. It works really well. I've had some doctors talk to me about it because I have underarm sweating that's pretty bad, and I might be doing that in the future. In fact, if you want me to make a Botox sweating video injection into me, God, I couldn't phrase it any worse, leave it down below in the comments. I want to make videos, at least a series, of different medical procedures being performed on me. If you're game, hit me in the comments. Jude Bratton, what eyesight does require glasses? I think you mean like, what should my eyesight be that I would need glasses? Well, glasses are important. First of all, I wear them. They can help with issues like farsightedness, nearsightedness. The ideal vision that many professions require is 20/20 vision, which means that you can see an eye chart from 20 feet away as well as a person with normal vision can see from 20 feet away. If you have 20/30 vision, that means you can see from 20 feet what they can see from 30 feet away, meaning someone with normal vision can see better than you. So 20/30 is worse than 20/20. There's no rules for this. If you have 20/30 vision, 20/40 vision, you may have that in one eye, in both eyes. You need to have a conversation with your optometrist or ophthalmologist. Some cases where you need perfect vision for your job, it's important to correct your vision early on. In some other instances where it's not a big deal and you're sitting in front of a computer, it might not be so important for you. I will say that if your vision is chronically bad and you're squinting and you're straining, that can cause headaches, irritation of your eyes, all sorts of issues. So I do recommend you go get your eyes checked. That's part of being a healthy person. Panic at the LSD sco. Sometimes I get random sharp pains from my uterus that don't always happen on my period and they can make me double over. Is this normal? Interesting that you can exactly pinpoint that it's happening in your uterus as opposed to your ovaries, your fallopian tube, your stomach, your intestines. If it's not happening along with your menstrual cycle, perhaps there's a good reason for you to go see your doctor and make sure that it's not something going on with your gastrointestinal system. There could be many different things happening, and that's why I think you need a doctor to sort of isolate other symptoms that may be going on simultaneously. Again, the best way that doctors make a diagnosis is through a careful history, asking you questions about what's happening and what other symptoms are going on, and two, doing a proper physical exam, putting their hands on you, checking certain aspects, pressing, listening with the stethoscope. The art of the physical exam is not lost. Lorena Pleska, does gum really stay in my system for 7 years if I swallow it? I need to know. I must know. Where did this urban legend start from? If somebody can tell me in the comments, I'm gonna be so grateful for this. If you swallow gum accidentally, your teacher called on you, someone yelled, it's gonna come out of you with poop, generally in a day or two. Do you know how I know that gum doesn't stay in your system for 7 years and I can prove it? Because I've done colonoscopies. I've done capsule endoscopies on patients. I've literally given them a capsule with a camera, goes through the digestive system. Guess what? No gum. Nothing hanging out there for 7 years. Gum is just basically like plastics. Sometimes it's like resin. Your body can't digest that. It can digest the sugars and stuff around it, but it can't digest the actual gum. So it essentially just makes its way through your digestive system. Now, that doesn't mean you should just start swallowing a ton of gum, because what can happen, and I've seen case reports of this, is if you swallow too much gum, it can form like a big ball and then cause an obstruction. Or if you swallow gum and then some kind of weird substances around it, like a coin, batteries. I mean, these case reports happen with children. The gum can encapsulate the coin or the battery or whatever, and then cause a blockage as well. But if you just swallow gum occasionally, it's gonna come out in your poop, not the end of the world. Don't worry about it. Here is cloud. How bad is it to inhale helium from a balloon? All I'll say is, it's not ideal. The only thing you should be breathing in is air. Notice I didn't say oxygen, because if you breathe in 100% oxygen, kind of doesn't make sense, because atmospheric oxygen is around 20%. See how I knew that? I went to school. I remember some facts. I don't know why I thought that was fun to say. Marie Teresa, like Mother Teresa. Let's say you're educated on how to do CPR, but not licensed. Somebody drops and needs CPR. No one there knows a thing about how to do it. Is it best to help the person? Will you get in trouble? Good Samaritan law should protect you in this instance, because if the person's heart truly did stop and they need CPR and you don't do it for the fear that you may do it wrong, that person's already gone. You need to do CPR. We need to not be afraid to do CPR. In fact, a recent study has come out and shown that women get less CPR when they have a cardiac arrest, their heart stops in public, because people are afraid to touch female chests. We should not be afraid to do this. If someone's heart stops, meaning they have no pulse, so they're not breathing and they're unconscious, please do CPR after calling for help so that you can extend their chance of survival. We need to be doing CPR. There's huge movements from New York Presbyterian Hospital to the American Heart Association talking about hands-only CPR, about how effective it is. We should all learn how to do it, and being licensed should only apply in a healthcare setting. It has nothing to do with if someone drops and goes into cardiac arrest immediately in front of you at the mall. Julia Kaiser, can leaving glass in your foot cause long-term harm? It's gonna cause long-term pain. Glass is not supposed to be in your foot. Like, is it gonna cause permanent harm? Not usually, unless you have like diabetic neuropathy and you don't feel it and it's constantly causing an open wound there and you can get an infection that way. It's probably not the end of the world, but if you see it, if it's causing you pain, it needs to be addressed. You don't want to have an open wound in your foot. Why? Because if you have an open wound in your foot, that's where bacteria might come in and say, what up? When bacteria come in and say, what up? And you get an infection in your skin, that's called cellulitis. What's near your skin and your bone? I gave it away. What's near your skin? Bone. If you get a bone infection, that's called osteomyelitis, because infection can spread from the skin to the neighboring bone. What happens then? Ooh, IV antibiotics for a while. That's problematic. Your foot's gonna hurt a lot. Get that glass taken out. Next time you do answering your medical questions, could you please tell me why I can feel an invisible pair of glasses on my face? Is it because you normally wear glasses and you think yours are still on? I need more. Ginger, give me more. Ginger! Tetris is me game. I don't know why I put a little lisp on there. Question, why do your taste buds go crazy when you're sick? Ooh, I don't think it's so much your taste buds. I think when you're sick, your nose gets congested, so you can't smell properly. And a big factor in how you perceive taste comes from your ability to smell foods. So when your nose is congested and you aren't properly smelling the foods, you also can't taste them well. I'm sure there's also something to be said about the inflammation that's going on in the back of your throat, in your tonsils. That could potentially also cause a problem for you, and your taste buds maybe make them a little bit less sensitive. And also, if you have a congested nose, you're more likely to mouth breathe at night, which dries everything up, can also affect your taste buds. Multifactorial answer? Naranjo. Question to Dr. Mike. Is it true that it is better for your digestion if you don't drink while eating? I have not seen this substantiated. I actually enjoy drinking while I'm eating, and I don't mean drinking alcohol, I mean drinking liquids like water. I feel like it helps me move the food along. I think it's something we recommend as doctors. Also, drinking water will actually expand your stomach and make you feel fuller, so it maybe encourage you to eat less. Vichy Price. Okay, here's my question. How are you a doctor with a strong gag reflex? Explain. I don't know. I've managed to control it. It's tough, but with time you gain experience and you learn how to meditate away your fears and uncomfortableness. Megan Doden, hard-hitting question. That's the only kind of questions I want on my responding to comments section. What does Bear's diet look like? What is your favorite brand of dog food? And what is his favorite treat? What is his cheat snack? First of all, Bear is an absolute vacuum cleaner. Whatever I put in front of him, he just goes. Sometimes I feel like he forgets to swallow because, he forgets to chew. Recently, his favorite snack has been lamb ears. But something that I always do is I always give Bear carrots. He loves chewing on carrots. They're healthy, safe for dogs, and I give him like 4 or 5 baby carrots and he's like the happiest noof in the world. Tom Hutch Videos 96. Can chest compressions stop the heart if the heart is already beating? First of all, I'll answer this question in a different way, not the way you probably wanted it. Don't do chest compressions if someone's heart's beating. The purpose of doing chest compressions is when the heart's not beating. I guess you're asking if you aren't sure if the heart's beating. Well, look, if the person's completely unconscious and they're not breathing, odds are their heart's not beating. So go ahead and do chest compressions. Call for help first, of course. Janine Fernando, what's your opinion on split sleeping, 2 to 3 hours in the morning, 5 to 6 in the evening? Is it healthy? I don't like it. Yes, there is some benefit to taking a little siesta when your circadian rhythm dips in the midday phase. But I think split sleeping like that, I don't see evidence for it. What I see evidence for is sleeping 7 to 9 hours of consistent, steady sleep of the same time at night. And then if you need to, taking a short 15 to 30 minute nap in the middle of the day when your circadian rhythm takes a little dip around 1, 2 p.m. Now we just gotta get those napping pods in all our offices, and then we'll be all set. And actually get our bosses to allow us to do the nap. Arrow Jade. I have a very random and interesting question. Is the study of dreams and how they work a profession on its own? I don't know if it's a profession on its own, but I know there are certain psychologists and even psychiatrists who do study the interpretation of dreams. There's definitely like a name to this. Study of dreams. I can learn something too in this video. It's called honorology. Honorology. The study of honorology can be distinguished from dream interpretation in that the aim is to quantitatively study the process of dreams instead of analyzing the meaning. Merker Ermer. Serious question. If EKG means electrocardiogram, then wouldn't it be ECG? It actually is ECG. EKG is sort of the old school name from the German definition, electrocardiogram. It was with a K, but now we do call it an ECG. In fact, when I order on my computer, I can either put EKG or ECG. Doesn't really matter. See, ECG. So we do call it ECG. Greg Lytle. Is picking your nose bad outside of the risk of spreading germs, etc.? Greg, this is a great question. A lot of people pick their nose. I think I've seen studies go up as high as 90% of individuals at one point in time pick their nose. And I'm sure it's more than that. They're probably just that last person's being like, I don't want to tell anybody. There are issues when you pick your nose. First and foremost, trauma. The inside of your nose is more sensitive than the outside of your nose. So by going inside and there, picking in there, especially with your fingernails, you cause trauma, cause nosebleeds, especially recurrent nosebleeds, because it takes forever for that area to properly heal. On top of it, your fingers, AKA your digits, are the dirtiest, meaning the most bacteria and viruses live on these bad boys. So when you're putting them in your nose where your mucous membranes are, that's a surefire way to get sick. In fact, one of the biggest things I recommend for people to avoid catching the flu is to wash their hands, A, and then B, to not touch their face. It means going in the nose. One of the most important methods to break a habit like nose picking, if you just have a habit and you're not compulsive in doing it, put something on your finger like a bandage that you use primarily to pick your nostril. Because when you do it, you're gonna remind yourself that, oh, I shouldn't be doing it. Because otherwise it can become really easy to just keep doing it. And please, don't go from the nose to the mouth after. Grovia Springham. If this old lady can run her first half at 55, you can do it. 2 hours is not out of the question for a healthy young guy. Good luck, you got this. I appreciate the support, Grovia, and seriously, amazing job doing a half marathon at 55. Amazing job doing a half marathon, period. Forget about your age. If you haven't seen this, I'm gonna link it down below. Nike and I have teamed up to try out one of their new running sneakers, and I'm gonna be running in the LA 13.1 half marathon in a month and a half. And I'm training right now, but it's a struggle. I'm essentially going from being a sprinter to a half marathon runner in like 10 weeks. For someone who's never ran long distance, that's really tough. And I'm 200 pounds. These thick thighs save lives, but hold me back when it comes to running marathon, you jive? Acareds. Is it possible that one day medicine will not be effective anymore since diseases like the flu keep evolving and getting stronger? The flu does not necessarily get stronger. It just continually evolves in order to keep surviving. That's what sort of nature's all about. That's how we came to be. There will be certain medications that will become less useful, yes. But at the same time, we'll create new medications. We'll learn new methods of fighting off viruses and bacteria. In fact, one of the main reasons why we recommend to not overuse antibiotics is to decrease this resistance that's forming. I have patients that I've treated in the hospital that they have bacteria that's resistant to every kind of antibiotic that I can offer them. That's called a multi-drug resistant organism, and that's quite dangerous. We don't want these superbugs anywhere near us. So let's not take antibiotics when we don't need them. When doctors ask about if you've been sexually active, what counts for medical purposes? Anything involving the genital region should count. If it doesn't, but you still think it does, say it. There's no harm. More information is always better when it comes to doctor's visits. LA Anonymous. Can you get a gallstone as a result of stress after you lost your job, had a loved one pass, etc.? Thanks for answering. Love your channel. Thanks for the love. You can get a gallstone anytime. A lot of times we don't even have a good reason as to why they happen. Obviously, eating an unhealthy diet full of fried, fatty foods is not ideal. And when one is stressed, you tend to eat more of those types of foods, so that can be a trigger. But in general, we don't have great evidence as to why it happened in that specific moment. The same way that, you know, when you get a cold or the flu, you can ask me all you want, why did I get it? I don't have an answer. It just happens. The Lorax. Mike, there's no such thing as a dumb question. Me, how much feet are in 7 minutes? Yes or no? No. I don't know why, but it's no. Think about that, Lorax. Black and white. I have a question. How do I send fan art to Dr. Mike? P.O. Box, baby, which I haven't checked in a while. I probably should. It's listed down below. It says, please send me stuff. Domagoj Lovasevic. Since higher body temperature is a good thing when fighting viruses, at what temperature should you take medicine to lower it? There's no specific temperature where there's like a cutoff. If you're becoming really uncomfortable, you can't sleep and rest and recover, that could also be an indication to do it. In general, if I have a low fever, 100.5 to 102.5, I tend to stick it out as much as I can, just because that will help my body fight off the infection a little bit better. But again, if you're uncomfortable, you might need to take something. Ronnie.bm. Here's a question. Do you wax your hands or something? Wax my hands? Ethan Green. I haven't remembered a dream for more than 8 years now. Absolutely no recall or memory of any dream. Is this a problem or does it matter? Doesn't matter. Not everyone remembers their dreams. In fact, some people that even remember their dreams, it doesn't happen to them every night. It's like a natural variance amongst humans. Zachary Kornfeld. Question, does seltzer water and normal water give you the same hydration? Yes, I think they give you the same amount of hydration. I do think that seltzer water is not great for those who are suffering with reflux, meaning like acid reflux, because it could cause you to burp. It can also cause the sphincter up here to not work well. The sphincter is actually what keeps the acid in the stomach. That's where you want the acid to be, because when it starts coming up and refluxing back into the esophagus, it actually starts creating irritation. That's when you get the feeling of heartburn. Make sure that you're only drinking seltzer if you're not suffering with that type of heartburn, and not too close to bedtime. Do you still consult a doctor when you're sick, or you consult yourself? Armand, great question. I consult myself as well as the resources that I use for my patients. Like if a patient comes in with a rare condition that I'm not 100% sure how to treat, I do consult those same sources, whether they're websites, textbooks. However, sometimes I do go reach out for help. Question, so as long as I can remember, my ankle has been cracking, and that's every time I moor it. I think you mean you move it, but check this out. I don't know if you hear it. My ankles crack. In fact, when I walk up the steps, my friends judge me. They're like, dude, why do you sound like you're 95 years old? I'm like, yeah, play me in ball one-on-one and we'll see how many years old I am.
Banks open on Tuesdays, folks.
Why do I feel a little heartbeat on the places I hurt, like the tip of my fingers? You mean like the pulsating feeling that you feel in your fingers, like when you hit them or jam them? The pulsating feeling is a lot of blood rushing to that area to clot, to bring healing factors, inflammatory cells. It also gets warmer, it gets redder. Those are all signs of inflammation. It's how your body knows something's going on. Cuddle muffins. Does your heart stop when you sneeze? Sometimes when I sneeze multiple times, my chest starts to hurt. Well, first of all, your heart's not beating all the time. It beats, relaxes, beats, relaxes. So if you happen to sneeze at the time it relaxes, your heart's not beating. I don't know if that counts. The reason you're probably experiencing chest pain when you sneeze multiple times rapidly is because when you're trying to sneeze, your body's also trying to breathe and inhale your lung, like expand your lungs. And when you try and expand your chest, those muscles are being pulled out, but at the same time you're sneezing. So it almost becomes like a pulled muscle in between your ribs. Imagine doing a curl and then all of a sudden something comes and stops you from doing it. It strains the muscle, it pulls it. I know that wasn't the greatest demonstration, but I tried. Hannah Bilal. My resting BPM has gone up to 160. I'm still young, but I don't think this is usual. Is there a problem and should I go to the doctor? Absolutely. You should go as soon as you can. The reason why I'm saying this is the resting heart rate should be 60 to 100 beats per minute. Anytime when you're at rest and it's going above 100, there needs to be a physiological reason why that's happening. Either A, you're consuming a substance that's raising your heart rate, caffeine, drugs, standing up and you're going to exercise heavily. That could raise your heart rate. Stress, anxiety can raise it. But to 160, that's a very high heart rate. That signals to me that something abnormal is going on that desperately needs to be checked now. Julian Vlogs. Is having interaction with your pet, such as being licked, hugged, kissed, hugging them or kissing them is harmful? Okay, that was an aggressive, very slow motion kiss. It's probably not great advice for a doctor to say that your dog should lick you because there is bacteria in his mouth, probably not beneficial in the long term, and there is a potential risk. But like when I cuddle with him and he kisses me, oxytocin gets released and that's like a cuddle hormone. It makes you feel good. It lowers your stress hormone levels. So I love it, but medically I can't recommend this type of licking. How long can he go? I'm not instigating it. Are you done? John Paul Turingen. How can I remove white stretch marks on my shoulders? Stretch marks are really difficult, if not impossible, to remove. Good way to think about them is almost like scar tissue. It's literally from your skin being overly stretched and scar tissue being laid down. There are a few what we call like aesthetic or plastic surgery-esque procedures that can cut out these stretch marks, but those come with obvious risks and you need to weigh the pros and cons for you. The creams that are out there, maybe they can help with the softness or the suppleness of your skin, but it's not gonna make the stretch marks completely disappear. Surgical procedures, possibly some laser procedures, and then creams. That's the order of efficacy going from best to worst. How come when I wash my hands and then dry them, they're still wet and no need to say my name? Did you dry them well? Like, are you using a heavy moisturizer? Are you sweating? If you're sweating, are you nervous? What are you nervous about? Were you nervous I was gonna try and pronounce your name? Your hands shouldn't be wet after you dry them. Kara Andrews. Hi, Dr. Mike, love your content. My question is, whenever you cough up any phlegm, is it better to spit it out or just swallow it, or does it matter? It doesn't really matter. Me personally, like if it's large enough, I spit it out because it's uncomfortable. But if it's like a small amount, feel free to swallow it. Your body's capable of disinfecting it because your gastric contents have such a low pH, meaning it's such an acidic environment, kills any bacteria that it would be problematic. A naturopath told me once that drinking while eating discourages the enzymes to work. What would you say to that, please? I love drinking while eating water. It kind of fills up my stomach and it prevents me from overeating. And it helps food travel down my esophagus. And imagine we could just make our digestive enzymes not work because we had some water. Oh my God, we would be the least effective organism on the planet. Humans have survived thousands of years, but if water goes into our system the same time we have a Big Mac, we can't get its nutrients. All right, I went a little heavy on that. Sorry, naturopath friends of mine. Little Jugno, is it true that keeping urine and bladder bladder for a longer time than usual risks kidney health. So let's start with explaining that the average human bladder holds 16 ounces of urine, which is 2 cupfuls. 2 cupfuls of urine, literally. So these are 8 ounces each. Letting your brain know when it's time to go is a really complex process. So if you continuously strain your bladder, you could actually cause yourself some serious problems. You may retain urine after you urinate. You don't have control over your urination. You could potentially have an increase in urinary tract infections. This isn't necessarily proven. Logically, it makes sense that if you're keeping that urine stagnant, that bacteria has a higher chance to multiply in that area. But look, if you're just holding it for a few minutes, hour or two, it's not a big deal. Know that your initial urge to go urinate usually happens when your bladder is about half full. That's a good time for you to go and urinate. But if you need to wait an hour or two, your body can handle it. Is Saturday truly for the boys? No, Saturday is for Bear. He's a boy, you're right. It is for the boys. Nico, why does my anxiety cause anxiety? Why am I more anxious in the evenings? Well, it's because anxiety is a vicious cycle. And in fact, one of the steps that we try and teach our patients to do is not to not have anxiety, because that's a very difficult thing, but it's to control the thoughts you have about anxiety. So if your thoughts are driving your anxiety to become worse, and we address those thoughts, we could potentially cut down your anxiety about your anxiety. It's what CBT is, cognitive behavioral therapy. Check it out, highly recommend it. Not just for those who suffer with anxiety, but everyone on the planet. I do CBT on myself quite often. My question, if someone wakes up in the middle of surgery, what do you do? I encourage them to go back to sleep with some medicine. Theophilos Mist, question, does sudden pain breaking your wrist increase the chances of passing out? Absolutely. Passing out from extreme anxiety, stress, pain, even seeing your own blood. All of this is a survival mechanism to not overwhelm you. You could absolutely pass out from sudden pain. In fact, one of the hallmark signs of breaking a bone could be passing out and getting really nauseous at the same time. Well, not at the same time, because if you're passed out, you're not nauseous, but those are 2 signals. Like I remember once, I've only broken 1 bone in my body, my left wrist. I was snowboarding, I thought I was really cool, and I wasn't on the bunny slope, and I fell, and right away I got so nauseous. It wasn't even painful, but that nausea, I knew there was something wrong. And when I came home, my dad told me, yup, you broke your scaphoid, which is a bone in the wrist, one of the most commonly broken bones in the human body. I like to sing sometimes. Me too, I'm not very good at it. My question is it possible for someone who is partially disabled, I have POTS, to go into med school? I want to become a pathologist, that is, it's something that has played a huge part in my life, anemia, and it has always been interesting to me. I think that you should absolutely follow your dreams. Just make sure that you're aware of what you can do and can't do so that you don't put yourself in a dangerous position or your patient in a dangerous position. So for example, if you know that you cannot stand for an extended period of time, don't do that just to please someone else. Explain what you're limited in and find alternatives or find programs who offer alternatives in order for you to participate in that education. No person should be withheld in education simply because they have a disability. Maria Who, question for Dr. Mike. How does the lack of affection affect your health? See what you did there, Maria? Social connections late into your life play a huge role in the quality of your life and the length of your life. These have to be meaningful social connections, and they have to be positive ones. Like, is it beneficial to your health to get married? It depends if you have a happy marriage. Happy marriage? Yes. Very sad, abusive marriage? No. If you're getting positive affection from your dog, from your partner, absolutely that's good for your health. It lowers your stress hormone. You get a release of oxytocin, which is that cuddling hormone, makes you feel good about yourself, motivates you, lowers your blood pressure. In fact, affection encourages you to do things like go outside for a walk, experience new things, and all of those things are good for the human mind and body. Mind, body. Why do my sunburns never turn into tans? Because sunburns shouldn't be happening to you. Shade, SPF. What's probably happening is you're actually burning your skin, and then that superficial layer ends up peeling off because there's so much damage there, and your body perhaps doesn't form enough melanocytes. That's what gives the skin color, the melanin, the pigment to your skin. And you may not be a person who has that much melanin in your body. That's okay. Wear that SPF. Stay in the shade. Maria Turturiello. Maria Turturiello. Turturiello. Maria Turturiello. Hi, Mike. What is the difference between a family doctor and a pediatrician? Well, a family doctor is able to treat patients of all ages, whether they're 1 or 101. Pediatrician solely focuses on children. Both are capable of taking care of kids. I see patients who are part of the pediatric population all the time. Vaccination visits, school physicals, complaints, developmental delays. You know, sometimes we need to get specialists on board, but that would be the same with a pediatrician because at the end of the day, we're generalists. And specialists are specialists. The Lannister Lion. Can giving CPR without a certificate have legal consequences? Well, I think it varies state by state, but generally speaking, the Good Samaritan rule should apply. That means if you're the only individual and you don't have a certificate, you can try and save that person's life. Because the last thing we want are people being afraid to help victims. So I urge you, if someone collapses, call for help right away. And if they're unconscious, not breathing, you don't feel a pulse, get those chest compressions going. Remember, to the tune of staying alive. That's all I'm gonna say, because I don't wanna get demonetized. Royal Twilight. I was wondering about the phrase,
"Banks open on Tuesdays, folks,"
and what it meant when you shoot against the backboard of a basketball hoop. That's called a bank shot. When you play horse, a game where you try to match your opponent's shot, you gotta call
bank
or backboard before you shoot if you're gonna use the backboard, and your opponent has to
match your shot with the backboard.
So for me, because I'm nice with it and I take a fadeaway and hit the backboard, I go, banks open on Tuesdays, folks, because it's true there and about the financial system, you know? Is eating food after it falls onto a non-sanitized surface bad for your health chronically? Are we talking about the 5-second rule? Because I think bacteria, when they see something fall, they're like,
yo, chill, 5 seconds, we gotta relax.
Not true. It's already gonna have bacteria on it. Is that the end of the world? Is it something I recommend? Probably not. Even my friends who are doctors do some absolutely atrocious stuff, like drop a piece of chocolate on the hospital floor and then pick it up and eat it and quote the 5-second rule. Please don't ever do that. Do you know what's in the hospitals? Multi-drug resistant organisms. You do not want one of those hanging around in your mouth. That's right, I said mouth. Francesca Simi. Why is it that when you take a bad fall, you feel nauseous and need to throw up? Well, first of all, it could be that you got motion sick from how heavy you took that fall. Second, if you fell so hard that you have a fracture, you could also get nauseous. That's one of the hallmark signs of having a fracture. I remember when I was on that bunny slope on that snowboard and I thought I was Shaun White, I fell. I learned my lesson because I got nauseous because I broke my arm. My wrist. Do we have a Dr. Mike Discord? Well, yes, we do. Although it is invite only if you sign up to the Patreon for only $10 a month, but that money is not for me. It's not for Dan. It's not for Sam, and it's not for Bear. It's for any good cause that we decide together at the end of the month, every single month. So join now, link below. Lonely Jashinist. Are doctors trained to notice signs of emotional abuse? Absolutely. Not just emotional abuse, physical abuse, elder abuse, and child abuse as well. For example, if I have a very young patient that's coming in for multiple fractures, if we do a bone scan and we see fractures that are at different stages of healing, that makes us wonder, why is this child frequently getting these injuries? Plenty of children like to be wild and run around and fall and trip. It's part of life. That being said, if it's consistently happening, it could be a sign of physical abuse or neglect, which is another type of abuse that's equally as important to notice. Now, elder abuse is something that's less talked about, but also very, very important. There exist individuals who are being kept alive, being neglected, being taken advantage of for perhaps financial gain. For example, many elder individuals will receive Social Security, government checks, retirement checks, and some family members really in a horrible way will try and take that money away from them. And instead of use it to give them care, they pocket it and use it for their own purposes. It's really evil, and when it happens, it's devastating, and we need the courts to step in. Rick Cheese. Does chocolate really cause acne? First of all, Rick Cheese, great username. To ask about chocolate, I thought you'd be asking me about cheese. I don't think we have proof that chocolate directly causes acne. Also, I don't think it's ever the case that a single ingredient or a single food can cause a problem that's as complex as acne. In general, when we looked at research in the past, what we've seen is those who eat a high amount of chocolate, and this isn't just cacao chocolate, dark chocolate, this is chocolate with dairy, with sugar, with a lot of high refined refined carbs in their caramel, all this stuff, they were more likely to get acne. Now look, those people also led more unhealthy lifestyles. They didn't sleep enough. They had high stress levels. So it's no surprise that they had more experience with acne. That being said, there have been some small randomized controlled studies showing that chocolate can have an effect here and there, but to villainize a specific nutrient like that, I just don't think we have enough evidence. What's really smart to do if you have acne is to talk to your dermatologist about all the things that can be contributing to acne and then narrow it down from there. Very rarely it's going to be due to a single food like chocolate. Like if a patient walks in and they have very bad acne and they tell me all the things that are going on in their life, I can't expect that if I'm just going to tell them, oh, cut out chocolate, you'll be fine. It's not going to be good medical advice. There have been some smaller studies that confirm that chocolate has pro-inflammatory effects. That means effects that create inflammation in your skin. That can be something that can contribute to acne. Second, we've seen high glycemic load diets. That means you eat a specific food, it spikes your insulin. That's considered a high glycemic load. That can sometimes cause an increase in sebum production, leading to acne. Sebum is that oil your skin creates and eventually or potentially can block off pores. But again, there's no direct tie-in that if you eat dark chocolate that you will then experience acne. I think it's more complex than that, and simplifying it to food X causing disease Y, don't have the evidence for it. Lacey Morris. Have you ever been in a situation where you had to feel a patient's abdomen, but they had PTSD? No, I would say the closest thing that I've had happen was I had to perform OMT, which is osteopathic manipulative therapy, on someone who was, I guess, traumatized in the sexual sense. And part of what I do, because they were experiencing neck pain, was evaluating the neck. And I really just went about it as forthcoming as I could be, meaning giving all the details of what I was about to do before I did it. That developed a layer of trust with that patient, and we just took it slowly, one step at a time. And that sort of desensitization really helped that patient a lot as we had more encounters, and we were able to get rid of her neck pain, and she's doing quite well now. So one key is sleeping at night healthier than sleeping during the day. For example, if you work night shift or third shift, does it simply depend on how many hours you sleep at once? When we look back at evidence, meaning look back at individuals who live the life of sleeping during the day as opposed to at night, and we compare them to those who sleep at night and work during the day, we see better outcomes for those who sleep properly at night, matching our human circadian rhythm. That being said, we don't have great reasoning for why this happens outside that it doesn't follow your natural circadian rhythm, and likely that because of weekends and everything else, you're gonna be shifting back and forth, and that's really unhealthy. My recommendation, if I was giving it to one of my family members, would be to try and find a career where they can sleep at night and work during the day. But I know that's not feasible for everybody. I don't want you to worry about it as if it's just this horrible thing. Just know that it is one potential risk factor that you can mitigate. Diamond on demand. I'm nearing 18 years, midlife. Should I start watching for my eating? Diabetes is common in half my family line. You should absolutely start looking at what you're eating now rather than waiting till later. I'll explain why. When we think about heart disease, meaning people that get heart attacks, their blood vessels start getting blocked off from plaque buildup within the arteries, within the blood vessels. But that plaque doesn't form when you're 40 or when you're 30. I mean, it builds up during those ages, but it really starts laying the foundation at your age, at 18. So if you can live a healthy life and watch what you eat early on, that's gonna pay dividends when you're in your 30s, 40s, 50s, 60s, 70s, 80s, 90s, 100s, 110s, or 120s. Is it normal to have a fat tongue, and is there any way to make it thinner? Yeah, sure, like if you just join a Planet Fitness or something and you just like, to be or not to be? That's a question. You asked me other questions and I'm about to answer them on this episode of Responding to Comments. Kaylee Mullins. Is it harmful to eat scabs? Scab. Ew. Is it harmful? Oh my God, unless it's like a pus-filled, no, just don't do it. Broken Mask Panda, the person. Question, why do my hands prune up really fast? My hands begin to prune in 5 minutes. Are you just like pruning while living? Or are you like pruning while you're pruning your bushes? Are you pruning in the tub? Are you pruning in the club? What up, bub? That went from a very medical answer to a very Dr. Seuss answer. Bernie beans. Is there any way to improve memory? Use it. or you lose it. How did I develop a good memory? I'm sure genetics are a part of it, but I remember when I was in 3rd grade, you know what my savage father made me do? When I had a reading assignment in social studies, he'd make me recite the chapters word by word while he looks at the book. I get one word wrong, he kindly hands me the book back and I go back in my room and try and memorize it. You use it, you peruse it. Kulsum Vizag. Question, is it normal to feel physical pain when you're in emotional distress? Yes. I have a whole video on how emotions cause physical pain. And I'll tell you something about COVID-19. During this time, when anxiety is at an all-time high, you would think my practice would be filled with patients coming in talking about their anxiety and depression. No, it's patients who have never experienced physical discomfort, meaning no aches, no pains, no injuries, are now having shoulder aches, neck aches, back aches, muscle spasms, and they don't know why. Because your emotions play an integral part in your physical health. Your mental state, your stress levels are all connected to your physical health. Mind, body, it's one word. Not only are we connected from a neurological standpoint, meaning that nerves are traveling and sending signals through, but we're also connected through an endocrinological, why can't I say that? Endocrinological, not chronological. Endocrine system also connects your mind and body. And if you're in a prolonged state for a chronic amount of time, you can have results in your physical health. Does it matter if you drink water while standing up or sitting down? Does it matter? Is this like a philosophical question? Brian Shrek, why does my eye twitch? I answered this question on the Today Show, and I may have given the corniest joke.
Uniquely enough, it does occur more in women. So guys out there, she is not winking at you.
Yeah.
Her eye just might be twitching.
I don't think it was funny. Do you think it was funny? Anyway, eye twitch, generally harmless, but some individuals can be predisposed to it. Risk factors for developing an eye twitch, stress, obviously, so we need to meditate, calm down a little bit more, be more mindful. Over caffeination, there's people that are drinking 400, 500 milligrams of caffeine in their coffees. That's too much. Eye strain from cell phones, computers, constantly staring at a screen all day. Do some relaxation exercises. Take a break every 20 minutes. And if it's happening quite frequently and you don't have an answer as to why it's happening and it won't go away, or it's really bad where it interferes with your vision, that's a reason to go see your doctor. Because there are true conditions out there that can cause an eye twitch that aren't just related to your lifestyle habits. Kian Alvarado, what is the best way to get rid of warts on the bottom of the foot? A procedure I commonly do in the office known as cryotherapy. It sounds like you're getting in a chamber and you're freezing yourself, but you're not doing that to your body, you're just doing it to the wart itself. In fact, there are some kits that are available over the counter that you can buy and do this on your own. But if you want a surefire way to get rid of the warts, come into our office. Usually it takes a couple of sessions to fully get rid of the warts, but my patients see great results and it's really rare to have any adverse effects. Grace Wisnowski, why do we sweat? Sweating sucks. Arid works. Right? Isn't that the commercial? Sweat stinks. Oh, that's an old commercial. God, I'm aging myself. It only seems to make me more hot and uncomfortable. Well, it certainly makes you uncomfortable, but it's actually making you less hot. Because when you sweat, you perspire, the water evaporates off your skin, thereby cooling the surface of your skin, thereby cooling the blood below the skin, thereby cooling your internal organs, and you see where I'm going with this. It's thermoregulation. If you were to overheat, you'd be running a fever, your body wouldn't be performing optimally, and you would eventually die if you didn't sweat. So thank your pores. Hug them. Appreciate the moisture that leaves your body. Cheesy weenie. At what part of becoming a doctor process did you take your oath? What was it like? You know, like, I think most medical schools don't even make you take a proper oath, but I remember we did. I believe it was during my white coat ceremony, which happens at the end of your second year and you go into your clinical rotations. You say it out loud in an auditorium with your fellow classmates. It was powerful. Some people had tears in their eyes. I tend to not get too emotional because I'm dead inside. Lauren Farkas, question, does cranberry juice really help treat UTIs? The evidence on this is quite weak. The reason we recommend it is it's kind of benign unless you're diabetic and you're getting a huge sugar load. The theory was if you drink cranberry juice, you will then acidify your urine somewhat. And then by having your urine be more acidic, it would thereby decrease the bacteria colonies in your urinary tract. Now, when we looked at research, it's kind of been weak to non-existent when it comes to cranberry juice. I know a lot of patients that still do it because they like natural remedies, but at the end of the day, if you have a true urinary tract infection, you're symptomatic, you don't want it to spread higher in your urinary tract to your kidneys and develop a pyelonephritis, because that's already a serious condition. Because complicated pyelonephritis could warrant IV antibiotics. Tristan Drum, I burnt my hand really bad last night, but today it's not hurting, but I also lost a sense of touch in my fingertips. Is this normal? Is it normal when you have damage to your hand that you experience possible neurologic symptoms? Yes. Is it ideal? No. Should you be evaluated by a doctor? Yes. Something else that happens, when you have a burn on your hand, you can experience contractures, which is actually the skin, the scar tissue that's being laid down in lieu of the skin, can actually contract a little bit, and your hand might not be as flexible. So these are all reasons that you should be consulting your doctor to make sure you have an optimal healing process. Daryl Hollandquist Jr., what's the importance of sleep for adults over 50? Well, the importance of sleep for those over 50 is the same that it is under 50. Maintenance, repair, and preparation for the next day. So get those 7 to 9 hours of sleep. But just remember, we've created a new age category for those over the age of 65, where the sleep requirements drop by an hour or two. And the reason for that is it's harder to get the full 7 to 9 hours. It's harder to stay asleep as you get older. The mechanisms in your brain sort of change. Getting a little bit less once you're 65 plus, may be normal for you. Since we've never developed a vaccine for any past COVID viruses, are you sure we will this time around? Sure? Absolutely not. Should we 100% bank on the fact that this vaccine is gonna work? No. Is it something that we're optimistic about and right now the trials are going well? Yes. I will continue monitoring the situation, looking at what studies are coming out, because there's several contenders in this space. And while we're seeing positive immune responses from these vaccine trials, meaning patients are in fact building immunity, what we haven't yet had is enough clinical data to show the safety profile of these vaccines, and that's what I'm interested in. Because vaccines don't just need to protect you from the virus, they also need to be safe as well. How do you know when you should go to a specialist rather than your primary care doctor or pediatrician, or when you should go from one specialist to another for the same reason? You should, in my opinion, almost always go to see a primary care doctor first, especially if you have a good relationship, a long-lasting one, because then they can guide you and tell you whether or not you need to see a specialist. Most reasons patients, when they come to see me, can be treated right then and there. Trinity, question, I have a double chin, but I'm not obese and I'm healthy. What is it and how do I fix it? Difficult question, Trinity, because I would need to see the shape of your face, the quality of your skin, your age. All of these things are taken into consideration when we talk about your appearance. That being said, I'm not a plastic surgeon, I'm not a dermatologist, so I don't perform procedures like injections, skin tightening, creams, even facelifts. All of those are potential options. Remember, unless you have a very enlarged, let's say, neck, which can predispose you to having sleep apnea, perhaps there's a thyroid issue going on, you're gonna be fine. And the fact that you have a double chin will not affect your life from a physical standpoint. But if it makes you unhappy, then it might be worth looking into. Jamarcus Lopez, what can people do to prevent seizures? It really depends on what causes your seizures. And a lot of times, especially for a first-time seizure, we don't know the answer to that. When I worked on the pediatric ward when I was a resident, we would have patients that would come in following a seizure protocol where we would actually try to induce the seizures while monitoring their brain waves. And things that we used to do include sleep deprivation, intense light therapy with like flashing lights. The question I would pose to you would be A, how do you know it's definitely a seizure that you're experiencing? B, have you seen a neurologist to figure out what type of seizure disorder you have? And C, figure out what your triggers are. And a lot of times that means asking you questions so you can figure out what the triggers are. Sarcophagus. I recently had a blood test and it turns out I'm deficient in the 4 vitamins H, U, G, and S. Can you provide supplementation? Oof. I think we're probably gonna have to supplement quite heavily on this. I think I'm gonna create my own line of supplements in these vitamins because I like giving them away. And I won't charge for them. I'm just gonna give them away for free. And I know you probably are thinking, Mike, that's not a good business model. How are you gonna make money on these supplements? But the real reward comes from the actual HUGS. If you didn't get it yet, where you been? Welcome. I have a question. In English, why do we say chicken pox instead of varicella? In French, we say varicelle. I don't understand the chicken. I don't understand the chicken either. I'm digging through the comments, Reddit, Facebook, YouTube, even my own personal Discord server, courtesy of my Patreon folks. Jason Roberge. On a previous video, you covered if cracking your knuckles was bad for you. How about other locations like your neck or back? Same principle really applies. Every time you hear crack Oh man, I won't be able to. But anytime you crack your back or neck, it's just nitrogen, air bubbles in your joints popping. If you're doing it because there's something unhealthy in your joints or your posture, that itself is unhealthy. Resident Discord Elizabeth, Mike, what medical specialty would you never want to go into? The answer to that would be radiology. And it's not because I don't like radiology, I actually think it's fun. I just can't sit in a dark room without having any patient interaction. I feed off patient interaction. I feed off this conversation that we're having right now. Do you feel that energy? Vibes, 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 vibes. Kim Vestal, what is the best personal medical alert system for the elderly? Ooh.
I can't get up.
I think the best thing you can do for the elderly family members that you have is teach them the basics of technology. Emails, texting, 911. That cell phone could be the difference between life or death. Stormy Sutcliffe, YouTube. Can people develop a food allergy late in life and then it goes away? Stormy, this does happen. A lot of times people package food intolerances with food allergies. I actually had a great dermatologist, Dr. Dave Stukis, on the channel talk all about that, and I'm linking that video about food allergies down below. There's a lot of myths out there, a lot of misinformation. Like those blood tests, they're not the end-all be-all when it comes to food allergies. Circleception 5. Hey, they say no dumb questions. That sounded like a rhyme. But how many individual strands of hair do you have? I have no idea the exact number of hair strands you have, but I can tell you that losing up to 100 of them in a single day isn't a big deal. Discord Vasily, can natural immunity wear off after many years of your life, such as obtaining chickenpox at a young age and never being vaccinated towards it? Yes, absolutely, immunity fades, and it fades at different intervals. This is why, for example, with COVID-19, we're very careful when we make statements about antibodies. A, we don't know what level of antibodies you need to be considered immune, and B, we don't know how long that level of immunity will even last. It's a new illness. And the flu shot, immunity fades. That's why we get it. Year after year after year, and it works, and it's safe. I just got mine. Gave it to Chuck Schumer too. Why haven't you gotten yours? Jenna Sharaya Thana, Reddit. Can we remove water from someone's lungs by holding them upside down at angle? like shaking them? No, you gotta perform CPR. Discord. Resident Power. You probably are like, why is he yelling Resident Power? This is a private Discord for my Patreon homies, my residents, those who signed up to pay $10 a month, and all of that gets donated to charity. And we all decide together where it goes. We have fun, there's a lot of behind the scenes content that gets posted there. We chat on a private Discord channel, so if you want, that link is down below, definitely sign up. Do you think it's important to tell your doctor that you're gay, lesbian, etc.? Not only do I think it's important for you to tell your doctor, I think a good doctor should ask the question. When I talk to my patients and I ask them if they're sexually active, that's one question. It's an important one. The next follow-up question should be, who do you prefer to have sex with? Or who do you have sex with? All of that faces different risks, different challenges, and we have to be open and ready to have all those discussions. Mel Vegas. Can you take medicines or even food if it's a few months past the expiration date? For food, no, unless it's a best buy date. When it comes to medicines, there's actually been studies by the FDA and by the United States military in looking at carefully stored medications, meaning that they're not stored in a moist environment, they're out of direct sunlight, they're between the temperature parameters that you're supposed to store medicines at, and they actually lasted 5 to 10 years past their expiration date. That doesn't mean I'm recommending you to take expired medicines, especially if they are life-saving medications. If you have insulin that is expired or an EpiPen that's expired, both life-saving medications, get them renewed. What am I talking about? Get them renewed. Facebook Chris Bowles, back muscle spasms. Why do they happen? Is it to compensate for an underlying problem? Why does the body inflict pain on itself? What is the point? I'm gonna tell you this answer in a very roundabout way. You probably would be confused at first. When we're trying to create robots, you may think that the most difficult thing for us to recreate in a robot that's human-like is the eye. Wrong, we've done it so many times. The ear, wrong, we've done it so many times. It's walking upright. Being able to navigate steps, slipping, hills, angles, pushes, force, all of that takes an enormous amount of coordination, constant firing of neurons, flexing and relaxing and extension of muscles. When that happens, it's very easy for a muscle to fire either in the wrong pattern or get thrown off balance and therefore create a micro tear. When a micro tear is formed inside the muscle actually spasms to protect itself. The reason why massaging feels good, why icing feels good, because it actually allows the muscle to get more circulation and heal itself. So it's not like the body is causing itself damage. It's more like the outside world causes all sorts of scary situations that your body deals with very well, that instead of dying, you get a muscle spasm. I think it's a worthy trade-off. Discord, cheesy weenie. Okay, interesting name. Do people who drink less get drunk easier when they do drink? Or does that have no effect? When you say get drunk easier, I take that as, do they look symptomatically drunk? Are they slurring their words? Do they seem out of control? Are they able to walk a straight line? Those who drink more often tend to have a higher tolerance of showing their inebriation.
Just drink, I like it.
That doesn't mean that it's the same thing as a blood alcohol content. Every individual will have their blood alcohol content slightly differ in how it goes up drink to drink. But those who drink more often will be able to tolerate a higher blood alcohol content and not show themselves being as drunk. Hope that makes sense. Jonathan Stern, true or false? The reason it takes longer to catch your breath on cold days is because it takes your body longer to heat up the air you breathe in order for it to be usable. Your body does have to heat up the air. It doesn't have to be heated up in order for it to be usable. There's a few factors at play. One, air in the wintertime is drier, so it can dry out your airways. That makes it difficult to breathe. Breathing very cold air can cause bronchoconstriction, where the bronchus, the airway that leads to the lungs, they can actually constrict and make it difficult to breathe as if you're breathing through a small straw as opposed to a bigger straw. Toomby Rath, in 2013, I was involved in a car accident that left me with a spinal cord injury. What are some good ways to lose weight as a paraplegic? Good news, 70 to 80% of weight loss comes from what you take into your body. So make sure you're eating healthy foods at the right amount and staying at a healthy weight, one that's healthy for you. Zoms. Question, I am 15 and 5'8". My mom is 5'1" and my dad's 5'10". What is the best way I can maximize my height, and what is your best prediction on how tall I would be? My prediction for how tall you will be is gonna be useless because I have no idea. My dad is 5'9", my mom was 5'9", I'm 6'3". Can't tell you how you can maximize your height. Get enough sleep. When you undersleep, you actually undercut your secretion of growth hormone. Growth hormone is massively important to your height and your bone growth. Get the right amount of sleep. Make sure you're getting all the nutrients and challenge your body physically, because when you exercise well, you will also have an improvement in your hormonal profile, thereby potentially getting taller. Discord, Dina Swisher. What's your favorite organ? PG version. My favorite organ is probably, I like the stomach. Not only is it cool enough that it can pivot, meaning it can expand and shrink depending on how much food you take in. It's very muscular and strong. It can beat up food. It has rugae in it, so it's all lined, and it can handle acid, so it's tough. And I like to eat, so stomach. Why do people twitch in the middle of their sleep and scare the pee-whoop out of me? You go through different stages of sleep, and when you're in your deepest stage of sleep, you actually turn off your musculoskeletal movements. That neurological system shuts down. But sometimes when you're going in between stages, it doesn't fully shut down and you're still in sleep and you're dreaming. So some of those movements actually do get through. Bear once did that too and he kicked me. I was upset with him. What actually causes the sensation of an itch? Well, this is a complex process that's primarily histamine driven. There is a specific type of nerve cell fiber known as a C fiber. These are sort of the receptors that actually initiate the sensation of an itch. Usually a response to like a mechanical or chemical process. It's an inflammatory response. It's a form of an inflammatory response. Discord, Naomi Multi-Fandom. Why are vaccines usually administered in the shoulder? Well, it's a great muscle, deltoid muscle, a lot of circulation. It's quick, it's easy. You don't have to get really fully undressed in order to make that injection happen. Back in the day, we used to use the gluteus maximus or the buttock. Now it's a little bit invasive and it's easier to just go in the shoulder and do the same thing. YouTube, The House Office. Why are you a fluffy cinnamon roll I must protect? First of all, I ain't no cinnamon roll, okay? The reason I ain't no cinnamon roll is because while I am delicious, I am healthy. Like a doctor?
I even sense it's coming.
Yeah, but you don't know what direction it's coming from.
There's no preparing.
You don't know what the word is gonna be.
Get ready for something like that.
What can cause a constant ringing in someone's ears other than loud music noise? What can get rid of it? This is really interesting because tinnitus is a constant ringing in the ears, and it can be a ringing, it can be a buzzing, it's all sorts of sounds that can happen. And a lot of times the reason why my patients come in is as a result of cerumen impaction or earwax blockages. Another thing that causes it is sensorineural hearing loss. You actually develop hearing loss for one of many different reasons, and as a result of losing actual hearing, you start hearing ringing in your ears, which is manufactured by the actual nerve that transmits the sound. A lot of people think it means you're hearing something. It actually could be a form of hearing loss. That's why it's very important to always get it checked out. Discord Ariel, a lot of medical shows, movies, you see med students shocked at being exposed to cadavers for the first time. Does this ever happen in real life where seeing a dead person for the first time, a med student will get sick or faint? Yeah, it happens. Also, the fumes of the formaldehyde are pretty stenchy. I don't know if that's a word, but I was kind of in awe the first time that I saw them. But the scary part was when I was studying for an exam late Friday night, that was for an exam on Monday, being alone in a cadaver lab, in the dark, hearing noises, thunderstorm outside, no bueno. Discord Jess Michio. I always get a runny nose because of spicy food. What is that about? That is about capsaicin. It is a nutrient that is found in spicy foods that actually bind to specific receptors in your body, giving you the sensation of burning. There's no actual burning happening. It's tricking your body to think it's on fire. And as a result, your body protects itself by trying to lubricate the area, releasing mucus, etc. It's a great way to clear your sinuses, by the way. I'm considering buying a posture corrector. Do they really work? Generally speaking here, I would say no. I want you, when you come in with a poor posture, is to figure out A, what's causing it, and B, to actually allow your body to fix it. Or if it's bad enough posture for an anatomical concern, refer you to an orthopedic specialist to figure out why that's happening. Posture correctors almost end up doing more harm than good in many cases, where they weaken your core muscles, your stability muscles, and as a result, making you more likely to get injured. There are certain ones on the market for specific conditions that may work, but I would generally try and stay away unless your doctor absolutely recommends them. Discord, Kristen G. What up, Discord? For those of you who don't know, we have a private Discord where we chat, Patreon members only, sign up down below. What's the best way to get electrolytes after a hard workout without adding sugar? Electrolytes are not added through sugar. Electrolytes are essentially salts that your body needs to function. And the way that you get these is by eating foods or beverages that contain those electrolytes. Sodium doesn't taste great after a workout, but after a grueling one, it really does help you absorb the water and stay more hydrated. Back in the day, they used to use pickle juice. It's true, tastes good too. Not bad, I like it. I like pickles. Dill? Is there a way for a civilian to test and see what kind of nutrients their body has a lot or a little of? I'm always confused about what to eat, and it would be great to know if I'm eating too much or too little of something. Currently, there's no such thing on the market. Yes, we can do specific blood tests to see if you're low on certain vitamins or if you're anemic and things like that, but generally we don't screen for these things. If you feel great and you have no symptoms, there's no point looking for them, because a lot of times, if you feel good and your lab value is a little bit off, we still decide not to treat the value, because the reality is we treat the patient, not the lab values. Why do our stomachs growl? Usually because they're angry. No, I'm kidding. The reason they growl is because of peristalsis. The muscles in the stomach actually try and churn the food in order to act as a form of mechanical digestion. Because remember, there's multiple types of digestion. There's chemical, mechanical being chewing, peristalsis, the stomach churning, and that makes a growling noise. Also, remember, when you're dealing with foods and there's bacteria inside our gut, there's also gases released. That gas, as it makes its way through the digestive system, can make those noises. And then at the end of the day, we fart. Lance McPhee YouTube, how often should you shower and wash your hair? I have this argument so often because there are people who say you have to shower every single day and wash your hair every single day. And that is in fact not reality. The decision to wash your hair should really be an individualized one, a holistic one, meaning that yes, if your hair is very greasy or your scalp is itchy or there's a lot of dandruff, maybe a good reason to wash your hair. Yes, if you come home and you're smelly from the gym, please shower. But otherwise, like if you just had a normal day, it's not absolutely mandatory that you shower. And it's not absolutely mandatory that you need to use shampoo. And depending on your hair type, also decides how often you should be washing your hair. Those with very fine hair, maybe every day, every other day. Those with more textured hair can go several days without washing their hair. But know that the more often you wash your hair, the more that you actually take off some of those important oils off of your scalp. You can actually cause damage, more irritation, dry out your hair, etc., etc. When it comes to showering, same thing. Your skin doesn't like hot water. Your skin doesn't like having soap all over it all the time. In fact, your shower should be really, ideally short, like 3 or 4 minutes, just focusing on like your groin, your armpits. That's about it. Why do so many people set a step goal count of 10K a day? Is there any scientific reason for this? Yeah, the 10K thing doesn't really mean much. Look, whatever way you choose to get active, it will be healthy for you. If you're increasing from 5K steps to 7K steps, amazing. If you've been working out 1 day a week and you've gone to 3 days a week, amazing. I will never be that rigid doctor that's like, oh, I see by your watch here, you've averaged 9,999.9 steps. I'm disappointed. It's time for me to cut you as a patient. Is eating burnt food bad for you? Actually, it is, Neko Mooser. You actually create all these cancer-causing chemicals when you eat burnt foods. So ideally, you want to stay away from charred as much as possible. In fact, marinating your meats help prevent some of those hydrocarbons and other toxic nutrients from forming. They're not even nutrients, chemicals from forming. Actually, eating greens with your meats helps decrease some of the cancer-causing minerals as well. Keep calling them different things, nutrients, minerals. They're chemicals. Seaweed time. Does banging one's head from the side actually shake water out from your ears, or is that something they do in cartoons? Don't bang your head. That's how concussions happen. Just jump. And the gravity will do the trick. If someone gets stabbed in the stomach, will the stomach acid seep out into their body and start dissolving their organs? Yeah. It's very problematic when someone has a stomach injury. Like, it won't completely dissolve their organs, but it'll cause damage. It'll cause a peritonitis. Hyper Shadow Sniper 76, when you're performing chest compressions, you break the ribs, right? Couldn't that broken rib puncture an organ below because you're putting so much pressure on it? You can, but guess what? If you're performing chest compressions, that person's already dead, and you're trying to bring them back to life. So anything you can do to continue their time by circulating the blood that's already in the circulatory system that has some oxygen left, you're buying them some extra added survival time. That's why you don't do chest compressions on people who are alive. Tara, Discord, is there a way to suppress my gag reflex? I literally gag every time I brush my teeth. I had a patient tell me the exact same thing. What I told him is, this is kind of a weird trick, tuck his thumb underneath his fist when he's brushing his teeth, and for some reason, this worked very well for him. Easy enough to try, but if it's happening quite often, seeing your doctor and figuring out if everything's okay in your oral cavity is probably a smart move. Sam Bowers, from 3 feet away, you said there's a much higher fiber content eating a fruit itself as opposed to just drinking the juice. Do I also lose a lot of fiber in homemade smoothie because the fruit is getting broken down by a blender, or does the blender not break it down enough to alter the fiber volume? Good question. You, Sam. And the answer is yes. The beginning of that mechanical digestion by your smoothie actually does decrease some of that fiber content because your body has to do less work now. I've answered hundreds of your medical questions on this channel, but I'm getting burned out. So I built a Dr. Mike robot, forced it to watch every single one of my videos, and now its artificial intelligence thinks it can answer your real medical questions. Why do I pass out at the sight of blood?
So it's a type of diabetes that you really want to avoid unless it's absolutely mandatory.
What in the world? Dr. Mike Robot, I think you've been drinking. Passing out at the sight of blood has nothing to do with diabetes, and you want to avoid it at all costs, not even when it's absolutely necessary. The reason you pass out at the sight of blood, it's almost like a protection thing. Probably has something to do with the vasovagal response or neurocardiogenic syncope. Your body actually has muscular control of the arteries in your lower extremities, keeping them tight, which maintains blood pressure, therefore maintaining circulation of blood to your brain, bringing oxygen. If something happens, like you're in shock, or it gets really hot, or you stand up too fast, sometimes those arteries relax or don't adjust in time. As a result, you don't have enough blood pressure, allowing blood to reach the brain, and you pass out. Are you good at sewing after learning how to do stitches?
I am good at everything.
False, answer Dr. Mike. I'm not good at sewing, and I'm just okay at doing sutures. Like, I can just do basic sutures only. Dina, is it true that drinking breast milk is good for bodybuilding?
I mean, research has shown that it is 100% certain. Maybe not for everybody, but for me.
No, not for me. That was an Anchorman answer.
60% of the time, it works every time.
Drinking breast milk is not good for bodybuilding because babies aren't bodybuilders. Oh, whoa, wait, hold on a second. Are babies bodybuilders? Because they're kind of building their body. I'm gonna go ahead and say yes, but not for the type of bodybuilding you thought. I ate a Lego, is that bad?
I have to say, this is the worst thing I've ever seen in my life.
Is eating a Lego the worst thing I've seen in my life? Oh, definitely not. You have no idea the things I've seen in my life. You have no idea the things I've smelled in my life. The hospital is full of smells, sights, sounds, things that I wish I could unhear, unsee, and unsmell. Azalea, what was the hardest part of med school?
The SCQ. You need a lot of therapy.
What is SCQ? I need to Google what this Dr. Mike is finding. Social communication questionnaire? I literally don't know what that is. But you do need a lot of therapy, so that is accurate. J. Tommy, could you overdose on helium like if you're breathing it in to make a funny voice?
Yes, absolutely. If you overdose on helium, you actually wouldn't die from it. It's technically kind of a status that it doesn't really mean you're dead. It's certainly a deadly thing.
What in the world did I just read? First of all, yes, you could absolutely die from over inhaling helium. If you just inhale so much helium that you're not breathing oxygen, yes, you can die. I've recently started trying to fall asleep with a fan on to keep cool. I noticed after a few minutes of the fan hitting my face though, I start to develop headaches. Is it possible to get a headache from a fan?
Yes, and the most common locations for headaches in the anterior cingulate cortex or the ACC.
Either this Dr. Mike robot knows a lot more than me or just completely making stuff up. This whole ACC singular cortex thing, no idea. What I can answer you is that you can get a headache from a fan blowing on you because what a fan does, it causes direct cooling of an area, which can then decrease circulation to that area, especially if you have a muscle, thereby creating a tension headache. Can I buy your dog?
No, you can't. You can buy a used dog.
What is a used dog? No, you can't buy Bear. I love Bear. This gentleman wants to buy you. Do you want him to buy you? Be honest. Yeah, I didn't think so either. Is there any benefit to using natural deodorant versus deodorant that has aluminum in it?
I love deodorant. It really does smell great, but I've never tried it on. Deodorant should only contain essential oils, and deodorant should contain no added fragrances to help your body smell properly.
Wow. I don't know what I just read, but deodorant should absolutely be used if you want to smell normally. The way deodorant works is one of two ways. You either have antiperspirant that essentially clogs the pores in your armpits, thereby decreasing the amount of sweat that's released, thereby decreasing the amount of bacteria that eats it and then releases a foul smell. Or you get a fragranced one that has alcohol in it that kills the bacteria and replaces their smell with the fragrance. I've heard that if you're having trouble falling asleep, you should close your eyes and then move your eyeballs in a circular motion.
What you're doing is very dangerous. Do not let your eyes close during these motions. That could potentially open up the blood pool and cause you to bleed out.
Oh my God, it's like cabin fever all over again. No, you'll not bleed out from moving your eyes in this fashion. That's a form of distraction. You're essentially giving your body something to do and concentrate on, at which point you'll get bored and fall asleep. So if that works for you, cool. I like deep breathing techniques, like having an inhale of 4 seconds and exhale of 8 seconds. Is it true that putting a wet cloth on your forehead brings down a fever?
Yes, that's great, but it's not the only way. Another thing you can do is to take some acetaminophen and a sort of antihistamine package and put that on your skin. It actually stops the fever.
Oh my God, it started off so good and then it just fell apart. Does putting a wet cloth on your forehead bring down a fever? Minimally. Minusculely, especially if you're really sick, your body's gonna keep that body temperature up. Now, if you do take acetaminophen or any antipyretic, any medication that lowers a fever, it will go down. Okay, I know some people don't believe in spirits, but when your ears ring, it could be a spirit trying to communicate, but it is probably a medical thing, right? I'm interested in this one.
The phenomenon is actually a medical condition that is essentially a disorder of the heart, specifically the left ventricle. This is the part of the heart that actually gives a voice to the heart. It receives the sound of the heart.
This is the worst robot. What you're describing here sounds like tinnitus, and that is ringing in the ears, and it can be caused by several issues. One of them being sensorineural hearing loss. So there's a lot of different issues with tinnitus. There is a rare condition, to give this Dr. Mike robot credit, where you could actually hear your own body sounds, including your own heartbeat. So there is some truth that you can hear your own body's processes in your own ears. Sunscreen blocks the UV rays from the sun that are damaging the skin. Does sunscreen also block vitamin D and other positive effects of the sun?
Yes, sunscreen is important, but it only lasts a few minutes. Before that, you should be in the shade. Some studies even show that the entire daily value of the sunscreen consumed by Americans is less than 1 ounce. So please, use it responsibly.
What is going on? This is so weird. Sunscreen lasts a couple hours, not a few minutes, so fact check on that. You should be in the shade, that's true. The daily value of sunscreen consumed, I didn't even know there was a daily value. I don't think there is one. While sunblock does negate some of the positive effects of the sun, like the vitamin D, it does still allow your eyes to see the sun, which allows the sun to set your circadian rhythm. How do you prevent acne scars? How do you remove acne scarring you already have?
Beans.
Beans. Just beans. First, don't pick at your acne. The more you pick, the more likely you are to get a scar. Also, treating the acne, meaning going to see a doctor, a dermatologist, to figuring out the reason behind your acne could go a long way to preventing scarring. Tal, how should patients go about finding a new primary care doctor? Ask for a list from our insurance company and play darts?
Insurance companies will have a list of providers that they can choose from. Also, I love darts.
Maybe one of the most accurate ones, although I don't really love darts, but that's a funny answer. There is a list of providers that insurance companies have. You get the list, and then you use the web to try and verify if other people have had good experiences there. Don't just settle on the first one, though. Remember, this is a long-term commitment, much like a marriage. Is it possible I'm damaging my eyes by staring at my iPhone all day?
Yes, you can actually stye up your eyes. Just look at it.
What? A sty in your eye has nothing to do with staring at your iPhone all day. Like, parents love bringing their kids in and trying to use me to spread misinformation to their children, acting like whatever their problem is caused by looking at a screen. It's not always the iPhone that's at fault. Sometimes it's serious things, so don't just always reflexively blame the iPhone. Hey, Dr. Mike, I've been wondering this for a while now, but how do you know if I need to get my toenails removed?
Tonsils.
Oh.
If it's very tender, like milk tonsillitis, you might need a phone consultation. If it's very inflammatory, like polycythemia, it could be a genetic problem.
Milk tonsillitis isn't a thing? Polycythemia is a condition, polycythemia vera, where you have excess production of red blood cells. The decision to remove tonsils happens A, how often you get strep infections, B, lifestyle issues that can come about as a result of inflamed tonsils, and C, a conversation between a doctor and their patient. Caitlin's world, every time I bend down or move my knees, most of the time they crack. Is this okay, or should I get it checked out by a doctor?
Your knees should be sagging at least slightly during the day. I would add that your hips should be sagging at least slightly as well, possibly more so, to give your hips a little more support.
Okay, maybe the only thing this robot could be saying is that when you're taking a step, you should be bending at the knees and the hips in order to absorb shock. I'm obviously reaching there. My knees crack all the time. It's no big deal for me. But that being said, there are certain conditions like a tear of the meniscus, which can cause locking and cracking sensations of the knee. So it really depends on what other symptoms are present. All these things are really important to check and evaluate using special tests with the art of the physical exam.